A nearly forgotten word, hope, has crept back into the vocabulary of some families in Miami County. Hope that here inside the newly opened Community Health Center of Miami County is their medical home. Quality, affordable, accessible health care for themselves and their families.
I told them what the problem was. And from the start, it was rough.
But you have hope now. For years, John Studebaker struggled to find medical treatment and low-cost prescriptions, finding it more and more difficult as the Peru area grapples with the economic downturn.
Ma'am, I'll tell you, this place, I'll be here. And the staff here is superb.
He's grateful that staff here enrolled him in Medicare on his first visit.
That's what we're all about. It's what gets me up in the morning and you know that we are making a difference, and already in such a short time we're making a difference in people's lives and impacting, and that's just what it's all about.
We have a tremendous number of people who are unemployed, and they are embarrassed, they don't know what to do, they don't want to admit that they don't have the funds to see a doctor, they don't want to admit that they cannot eat sometime. So we are having a lot of help for these people.
Hope has many faces this Thursday afternoon in early August. It is day 36 since the new Community Health Center of Miami County opened. Since then, it has changed the lives of more than 180 new patients, including 72-year-old John Studebaker, 2-week-old Ariana Johnson, and Lee Brown, who's uninsured.
There's no jobs. Fast food, which is a hard job, but I can't do that anymore. And it's hard. It is difficult. And then when they told me that I didn't qualify for Medicaid because we got married, I was, oh.
I intend to keep my promise.
In February 2009, President Obama designated Indiana health centers to receive $1.3 million in federal stimulus funds to develop a new community health clinic.
It is great to be back in Indiana.
It is one of only 2 in Indiana and one of 112 nationwide to receive the Recovery Act funds. It had to be up and running in 120 days, a challenge logistically. But as one of the nation's leading authorities on community health centers, IHC's CEO and her staff have plenty of experience to draw upon.
I called having, dozens of people running at the speed of light. Everything needed to fall into place. We know what we're doing. It was so exciting to see the recognition of the role that health centers could play as shovel-ready, able to get up and moving in the hardest hit areas of the country and provide access to residents that would otherwise not have access.
On June 29th, right on schedule, the Peru community celebrated the clinic's grand opening. It had been 3 years in the making.
Well, it's hard to describe, but it's a very uplifting day, rewarding day, and something that is going to be very good for Miami County now and in the future.
U.S. Congressman Dan Burton praised community health centers for serving the unemployed, uninsured, and underinsured.
The health problems facing the country are pretty well known, and the Indiana Health Centers provides a very important service for people that are having a difficult time. And right now, nationally, we're trying to come up with a new system to deliver health care, and this is one of the things I think we need to show as a showplace.
The unmet medical needs are great. More than 1 in 4 Miami County residents live at or below 200% of poverty. More than 40% have no health insurance. 1 in 5 expectant mothers receive no early prenatal care. Miami County residents exceed state and national averages in all cancers, including lung and colon, heart disease, liver disease, teen pregnancy rate, and very low birth weight. As a not-for-profit, mission-driven organization, the Community Health Center of Miami County provides a medical home for all, prenatal care, immunizations and flu vaccines, lab tests, health education and assistance with medication, bilingual staff, eligibility assistance with Medicaid, CHIP, and HIP programs, and discounted fees on a sliding scale based on income and family size.
It's doing well. We were lucky enough to have residents start calling as soon as they knew that it would be opening, and so we've been running a pretty full book of appointments for the number of providers that are available.
17 caring professionals, including 2 board-certified physicians, 2 nurse practitioners, experienced nurses, and a case manager, bring more than 185 combined years of medical and patient care experience to their work each day.
Some people who've been sick and felt like there was nothing that they could do, and to see them so excited about, oh, it isn't completely hopeless. These people are here and available to help me.
The clinic is located at 1694 West Logansport Road in Peru, just off Main Street. It is open 54 hours each week, including all day Saturday and 2 weeknights until 8:30. Community input helped determine the hours.
We're looking at baby right around the 75th percentile, given her age. And
Dr. David Sedigat visits with Amber Johnson on the progress of her 2-week-old daughter.
she did exactly what we wanted. Lift up her head, that's what we want. That's excellent. Sorry, Ariana. Sorry, little lady.
Ariana is beautifully healthy, thriving, and gaining weight. This well baby visit is a landmark in the life of a new mother and her newborn. It also marks another landmark, another patient served, another opportunity to make a difference in the lives of the community in and around Peru.
We are in the right place, in the right time.
They can come to us with whatever medical need that they have and know that that need will be met.
And when they called me, I said, well, I'm retired. I have been retired for 4 or 5 years now. I jumped. I said, I'll help you. And I'm glad they asked me to come in.
We are taking care of people who don't have other means to get health care. In this particular time with our nation's economy and this area, with a lot of people losing their insurance, we are where they're falling to.